No one is talking about the relationship between ADHD medication, and chronic pain. Let's talk about it. For starters, my name is Dr. Heidi. I am a doctor and I have ADHD, and I love nerding out about research papers about ADHD and talking about it with all of you. There is a surprisingly small amount of information on this topic, period. I actually found information that goes against what this question was saying. Research suggests that some of this ADHD medication may help with the perception of chronic pain. There's even a study that I found that suggested that people with ADHD might be hypersensitive to pain. Treating them with things like methylphenidate, which is the active ingredient in Ritalin, might help to decrease their pain. This study looked at cerebral blood flow in like 50 different patients. It only looked at people with ADHD in this study. It was a retroactive analysis. It looked at people who had been treated with ADHD medication for 1 year, and they looked at their cerebral blood flow in certain regions of their brain before and after that year of treatment. What they found was fascinating. In the beginning, cerebral blood flow was higher in these areas. One of these is called the precuneus. This is part of a network called the default mode network, commonly implicated in ADHD symptoms. When people have an increase in blood flow in their default mode network, typically active at rest, or worse at things like task initiation and having blood flow to our prefrontal cortex, which is involved in executive function. When we take ADHD meds, it turns down the volume on this default mode network that allows us to have quote unquote higher order functioning or things like executive functioning. Basically, they found that that area overlapped with people with chronic pain. The patients who were taking these medications that affected the dopamine pathways, dopamine and drugs that affect dopamine can influence the default mode network, help ADHD people have better access to things like executive functioning skills. For example, this patient who had fibromyalgia was taking a dopamine system stabilizer. Their symptoms of both pain and ADHD improved, and they had a decrease in the cerebral blood flow in the regions that were listed. Decrease in blood flow is actually a good thing if you're decreasing blood flow to portions that are operating in the default mode network. In summary, we need a lot more research in this department because tons of people are experiencing chronic pain and have ADHD. We would all love to learn more about it. This is a great start. If you like learning more about your ADHD brain and nerding out about the science, follow me. And I love being a nerd about this with you all. And I talk about this all the time on my channel.